Hello. Welcome to the stream. Jeff is just going to figure out his audio there for a
Oh
moment.
yeah. Sorry,
Welcome, Jeff. Thank you for
sorry
joining
about
me.
that.
Now, Jeff, we're going to be throwing the hard COVID questions at you as a resident expert on COVID.
Oh no.
You didn't get in quick enough. Now I'm the host.
Yeah, absolutely. I just pressed one random button on my computer and then wondered why nothing was working. Oh, well, there you go. Kia ora, folks. Welcome to. You can tell it's Friday, right? It's definitely Friday with a start like that. It's definitely been one of those weeks. Particularly, I'm sure if you're living in Auckland, because the rest of us around the country, we just can't gather in groups of 100 or do anything silly like that. But in Auckland, it is still level 3. So our heart goes out to you. Thanks for being the front line of defense for the nation and for all of your sacrifice during this time. And of course, that's what we're here to talk about, the COVID outbreak. And with our resident expert, Dr. Ben Peters. Kia ora.
Thank you for having me. Kia ora, Jeff.
Thanks for kicking things off for me, Ben.
All good. All good.
While I was being technically illiterate. Hey, so I just thought I've got a few questions I want to throw at you to start with, and then we're going to open it up to everyone. So folks, if you do have questions, feel free to put them in the stream and we will get to them. But there's a couple of questions left over from last week and a couple of things that have come up during the week that I just want to run past you. I mean, firstly, there's been quite a lot on social media about whether the lockdown is justified, and people comparing it to the flu and saying how many people how few people died in New Zealand in the during the first wave that we had, all that sort of stuff. What's your views on that?
Yeah, thanks. The lockdown has absolutely been justified. And even when we compare it to the flu, what's been really interesting is seeing that actually this time, or this year, we've had far fewer deaths from the flu as well. So we're actually saving lives more than just mitigating COVID deaths. We're saving lives compared to previous years and compared to previous flu seasons. So we're about 1,000 lives up from the lockdown. That's not 1,000 lives that we saved from COVID. That's 1,000 lives we saved from other things that didn't then kill them during that lockdown period. And so the overall effect of lockdown has been a massive net positive on our health, where we have had virtually no COVID deaths, which is fantastic. I think you don't have to look too far overseas to see how the massive impact that's had in other countries. We're getting up to, I think, about 700,000 deaths, with about 24 million cases of COVID worldwide. So these are like staggeringly huge numbers across the globe.
And just to jump in on you there, Ben, because there's very different death rates overseas that we're seeing. Now, I'm guessing partly that's due to different levels of testing, but also presumably due to the fact that some health systems are getting overwhelmed and therefore more people are dying in those countries.
Oh, yeah.
Is that right? Or are there other things as well I'm not taking into account?
There's a lot of things in there factoring into the death rate. So when we look at the kind of the true death rate, which is kind of a bit unknown, because like you said, it matters about the testing. So how many deaths are actually being correctly categorized as COVID deaths versus other things. And there'll be an awful lot that are getting missed. It's more likely that we're missing deaths than we're over-prescribing deaths to COVID, because there'll be so many, especially in areas where health systems are overrun, especially in less developed countries where there's far fewer tests available. You're not going to be wasting those tests on people that are already knocking on death's door. So it's really important to understand that death rate is lower than we expect. When we then look at the death rates this year, so the kind of total deaths this year compared to previous years, we can also see that there's extra deaths that are not being counted in countries with high levels of COVID, and they can be really, really significant numbers. So that's also playing into it. When you're looking at a specific country and you're asking what is that country's death rate, even if they have good testing, your demographics there really, really matter. So if you have infections that are getting into old folks' homes, if you have a much more at-risk population and you have a significant outbreak, then you're much more likely to have some issues there and have higher death rates. New Zealand,
I really noticed that in Italy and Spain when I travel there, in the past. I mean, they have and it's a fantastic culture. Their elderly are out, they're socializing all the time. You see them, they're very visible. They're playing chess in the city square and all that sort of stuff. And presumably that's actually been a downside for them in terms of transmission amongst vulnerable groups.
Yeah, and there's some comorbidities there as well. In America, we've seen the Pacific Island population in America was particularly hard hit, and it's possible that that's actually some comorbidities, well, not comorbidities, but some underlying genetic differences there that are playing into that as well, because we know that the ACE2 receptor is really important for your how well the virus infects you, and there can be variation amongst the population in that. So there is a real awareness that we need to have in New Zealand that our comorbidities might be a lot higher, or our risk factor might be a lot higher if an infection took off in New Zealand.
And so ACE2 is just like a genetic thing, is it?
Yeah, so it's a little protein that we have in some of our cells, so particularly in the lungs. It's also in other areas around your body, but mostly in the lungs, and that's why we get an infection there. And it's the little thing that's required for the virus to come along, bind to it, so then the virus can go into the cell and start doing all its replicating stuff.
So people of Polynesian heritage could potentially be more susceptible to the virus.
Potentially, yeah. And I think because we've seen that kind of play out in the US as the demographic data, but we don't have the studies done yet to actually make any conclusions about whether there is a thing there. But we do need to be very cognizant in New Zealand that that might be a big problem. We have a big Polynesian population that we want to take care of. And so we really want to be quite aware that data from one country and another country is not always comparable. And New Zealand, the first time round, we got away with a really, really low death rate, in part because we had really young people that were getting infected. So in our 20s and 30s, they're mostly overseas, having a fantastic OE, doing their career stuff, coming back, and then that's how our infection was getting into the country, and 20 and 30-year-olds mixed with other 20 and 30-year-olds, and they're the ones who were tolerating the virus more. So we had a very skewed age demographic in our first wave infection, and it's not going to be quite the same in the second. And so that'll be something to keep our eye on, and something to be very aware of going forward, is that New Zealand's demographics are actually a little bit at risk. So it's very appropriate for us to have a slightly more cautious approach this time around.
So we don't know how lucky we are, is the summary I take away from that.
Yeah. We've been just spectacular. I mean, like, you know, people always say, is it luck, is it hard work? And you need both, right? Absolutely. We worked real hard as a team of 5 million. We did that lockdown together, and we managed to smash the virus. There was some luck in play there that, you know, actually let that happen, that we got it to the level we did in the time frame we did. But it wouldn't have happened without all of that hard work that we all put in. Yeah,
and maybe Aussie didn't have that same level of good luck.
Maybe less compliant citizens.
Yeah, maybe.
No shame.
So what do you think we could be doing differently now going forward?
Yeah, I mean, we've had 100 days COVID free, and it's now it's back, obviously, but it is something that we should be thinking about as to how do we manage this in the future, and also right now. And I think potentially having all of our isolation wards and all our isolation hospitals in the middle of our biggest economic zone might not be the greatest idea.
That's actually I mean, I don't think no one's been talking about that, but that's
I saw one stuff article that proposed a particular airbase that could land international planes that you could outfit. You'd need to invest, right? You need to it's a shovel-ready project if there ever was one. But, getting those isolation facilities established in a place that would actually make them more robust to the human era. We don't know the cause yet of where this particular case came from. Like, we know the individual, yes, but we don't have an idea of how they actually got it. We don't have conclusive evidence yet that I've seen, unless I've missed something in the news. But likely it's come in somehow. And potentially isolation hotels are probably the biggest risk we have, in terms of, we do know that people are escaping occasionally, or that there's those things. I don't want to start any online rumors saying that we have a cause. We don't. But we do want to think about what things could we do that would minimize that in the future, and potentially allow us to upscale the people coming into the country. And I think having a smarter think about our quarantine, i.e. get it away from our economic zones, could result in a lot fewer lockdowns in the future to actually make that.
What about Queenstown? There's a few hotels down there that probably need some customers.
Well, they did investigate that. It was in the Aotearoa a while ago. In the end, they ruled out that they couldn't. I can't remember why, what was wrong with it. But yeah, again, I don't know if you want to put it in a place where other New Zealanders are also going to go to a whole lot. Like, I get the allure of putting it into existing hotels because it keeps those hotels in business, as well as using the existing infrastructure. But as we look at this long term, this isn't something that's going to just disappear next year. I don't think there's this silver bullet that's going to come out and suddenly no one has COVID anymore and we can all go back to normal. That's really unlikely. And so I think we actually need to be thinking now, how do we cope for a year or more?
Which brings us to the subject of vaccines, because it's quite a nice segue you've given there, because there's been, well, Australia now, of course, in the news this week as potentially having access to the Oxford vaccine. What's your view on that? Is that a massive coup for Australia, or is it something not such a big deal?
The actual acquiring of the vaccine is, I mean, I think the companies come out and said absolutely they don't have any procurement contract in place. What's the last I read on that? I think we are geopolitically quite tense. Every country is kind of going, how do I look after my citizens? How do I get there first? How do I make sure that we're protected? Unfortunately, we don't know how effective this vaccine is actually going to be. It may confer excellent immunity. It may only confer a small amount of immunity, and that may only be for a short amount of time. And so I think we need to be communicating quite openly with the public about actually how effective the vaccine is as that data becomes available, right? We don't have a lot of that data yet because it's only, we're still in trials. We're still figuring out how good it is. And we won't have that long-term data because there just hasn't been the time. It's only been 7 months. So
people are used to thinking of vaccines as being like for polio or
amazing.
So it's one prick and you're good for life, but that's not always the case.
Absolutely not. And especially with a really early vaccine like we're developing now, it will be safe, but the question is how effective will it be at long-term immunity? And we just don't have the information. Even things like the polio vaccine, the first round of the polio vaccine was actually a bit rubbish. It was desperately needed, and it was rolling it out did have a massive impact on the epidemic at the time. But we developed a better one 10 years later that then really was the nail in the bucket for eliminating polio. And so these things can take time to get it really, really good. We're probably going to have an okay vaccine at some point, but actually rolling that out nationwide, or what that means to get it to everybody that needs it, is a really big and challenging question for New Zealand. I think New Zealand should be looking at trying to get its own vaccine production happening when they can. We do produce some vaccines ourselves in New Zealand. Mostly it's animal vaccines actually that we make. But again, you can produce the same kind of base structure thing that you need for the vaccine. Here in New Zealand, we would need to procure some other elements in it. But I think that is absolutely something that we should be looking towards doing as a country and going, right, we can. And even then, if we don't need it, we can use that internationally to help our international partners. And that's a great, leading the example in the world, because currently we are, right? New Zealand is number one when it comes to the COVID response so far. And we should be really proud of that. And I think the more we think forward, the more we can maintain that position and show the world how we can do this right.
And just to finish that subject of vaccines, Jacinda's saying she won't make it compulsory. Australia saying they will. Thoughts?
I don't think we should make it compulsory. Any compulsory vaccination programs sound politically nice because you go, yeah, we're doing the right thing for people. What actually happens is people just disengage from your health systems. When they do that, they then you have pockets of communities that are vulnerable. You'll still interact with them. They'll still be around, but we won't have any idea about that because they'll do everything they can to hide that information. We aren't likely to get enough vaccine to do it for the whole country, right? That's an awful lot of doses. And especially because New Zealand's going to be really low on any kind of wait list from the World Health Organization. We have nearly no active cases. We're at 100 at the moment. There are countries where COVID is absolutely ravaging the country. They are going to be really high on the list for getting the vaccine from international efforts. For New Zealand, it will be about what we can do to produce our own and how we can effectively administer that to protect our most vulnerable. And that might be things like vaccine ring fencing, where you kind of vaccinate all the people that would interact with our most vulnerable group, but not the whole population. So that's
right.
Kind of my thoughts.
Nice. Oh, that's useful. And of course, the other big thing in terms of what we should be doing differently has been, around the the border response. And I don't want to get into the kind of the blame game. We'll leave that to Judith and Chris Hipkins to work through. But I mean, it is pretty clear that the Ministry of Health has struggled to deal with this as an operational organisation, and that there is a gap in New Zealand's in New Zealand's infrastructure, if you like,
absolutely,
for this sort of outbreak.
And because we manage everything at a DHB level, and so we're seeing very different responses through different DHBs, and I think it's part of why TOP is calling for that independent public health commission, if I've got that right. So it's really about having an independent body that is the one that really is driving our public health initiatives. Back in 2008, we had the highest rates of vaccinations for measles in the world. And then last year or a couple of years ago, we had a measles outbreak that went to Samoa that killed 150 odd children. Wow. So the lack of a public health commission, the lack of that constant message that public health is important, is really hurting our vaccination rates, is really hurting our public health efforts. And if we had that already in place, that would have been, we probably would have had a swifter response to the COVID. And right now we'd be able to keep a much more independent response, especially given that we've got an election going on and every politician is trying to do their jump up and down. Oh, I'll do better. We need that independent body to make sure that we have that independent kind of governance of this response there.
So they'd be the ones talking about the sorts of ideas that you're talking about with a quarantine zone, that sort of stuff.
Yep.
Which of course the politicians don't want to talk about because it's election time and it's all too risky.
Oh yeah, and everything. I mean, partly they don't want to talk about it's too risky. Partly they don't have the time to think about it because they're too busy trying to think, how do I get voters to notice me? How do I get out there? We need to push the election back for 4 weeks so people can see my face more. And it's that kind of thing that's really annoying. And I know some people are a bit grumpy about the way I'm phrasing that pushing out of the election. I want to be clear that the Electoral Commission, if Jacinda hadn't made the call, they, as an independent body, would have the power to push out the election, and I would have 100% respect the Electoral Commission. They could have done it on their own steam the weekend after, and really what's happened is actually there's a huge amount of administration that now needs to happen to run an election, and pretty much all of the 4 weeks is going to be consumed just shifting the election date. Very happy that people should be safe to vote, very happy that we should be taking precaution in our campaigning. That's why we're doing a bunch of this. We're adapting on the fly. We're good at doing that. But we need to make sure that we try and actually show the world that it's possible to have an election during a pandemic, because there's a small country that has an election in November that's really important that it happens. So I think if New Zealand shows the way that we have an election and we can show how it can work sensibly, that actually does show up a certain president that's been disparaging of our numbers of late.
Awesome. Hey, okay, so let's start taking some questions, and whatever stream you're on, you can put your question in, and we should pick it up, thanks to the marvels of modern technology. So the first one, I want to run past you, and I think you've already kind of answered this in what we've been talking about, but this person thinks we should also count the deaths that may be related to the lockdown itself. So people who may have been unable to access public health, and for example, those that might have been, hurt by the economic downturn or whatever. What's your thoughts on that?
Absolutely. I think, so on the economic downturn first, although I'm not the economist here, what we are seeing is that countries that shut down harder earlier are bouncing back quicker. Effectively, a lot of that income is not lost. Also, the job loss is, but a lot of the expenditure is bouncing back quite quickly because people simply couldn't spend over that time, but they're still having that income coming in a lot of cases. Obviously, the job loss is pretty bad there. There's also an element that it's lockdown regardless. Even if we didn't have closed borders right now, there still wouldn't be that many planes flying. So a lot of the time, the change in behavior actually precedes the official government order. In New Zealand's case, because we were so proactive, the orders came first and the behavior came second. But in many countries, they saw that people stopped going out to eat, people stopped going to bars, regardless of what the countries were saying. And so
that is crucial. That is crucial, right? I mean, talking to people in the US right now, people are not going out, and it's not because of the restrictions. They're just not going out because
they just don't want to die.
Yeah.
Who can blame them? Like there's a genuine global pandemic. As for the other actual deaths that occur because of the lockdown, there really isn't evidence at the moment that that's happening. Yes, there is a big strain on the health system to catch up on everything that got delayed, because we did see that it was a fairly quiet time in hospitals during lockdown because people were putting off treatment and people were simply not allowed to go in for certain things as well. And so I think that is a cost. And absolutely, it highlights how our health system has been under strain for so long and why we need to have some fundamental change there, and really shift to hopefully more proactive health, preventative health, so that we can minimize the long-term impacts that we have on our health system. The more we keep treating at the end, the more expensive our health bill gets and the harder it is to actually give people fair and equitable health treatment.
Absolutely. Yes. So one comment here from Nadine: we should be bringing in all flights into Christchurch Airport and having the quarantine facilities in the South Island to fill our motels suffering from lack of tourism. That way, if there's a leakage, we can just shut down the whole South Island.
Yeah, and I mean, hey, look, South Island economy is very different to North Island economy. A shutdown here, a lot of the farmers will keep farming. You're not
true.
getting animal to the human transfer there between. So there's definitely an argument to be made, and there's definitely a discussion to be had around where quarantine is actually the most sensible place to do it. Whether or not that actually goes through existing hotels, motels, or a dedicated purpose-built facility where you could relocate staff to, or things like that, is something that I think you'd really want to get a bunch of experts around a round table and go, right, if we're doing this for a year, 2 years, 3 years, like we really don't know when the end point of this is. Hopefully it's soon. I think we're getting some treatments coming through that are starting to look quite promising, some antivirals there, which we may touch on. But I think you would look at that and go, right, is there actually a need for some kind of dedicated quarantine facilities long-term to deal with this and to deal with future ones? This is not the only event that will happen in our lifetimes, potentially.
Yeah. I mean, at the very least, we have to have a good think. And I think you made this point right at the start, Ben, actually, of the pandemic. At the very least, we have to have a good think about how we configure our airports, right?
Yeah.
Because this could very easily happen again.
Yeah.
Question from Sarah: do you think that returnees and managed isolation should be wearing gloves as well as masks if there is potential for spreading from surface contact?
Yes and no. So gloves are a useful barrier between your hand and other stuff. Things getting on your hand, like virus getting on your hand, is very easy to kill with soap and water or with hand sanitizer or anything like that. The reason why you may not want people to wear gloves is because when you're wearing those gloves, you then think that your hands are always clean, even when they're not, right? So by having regular hands touching surfaces, you kind of have in your head that you've touched that surface and your hands are okay, so I'm going to go wash them with some sanitizer. If you're wearing gloves, you think, I'm always clean, touch all the things, then you touch other things, and then you take your gloves off and you touch those same things. And it's not going to be really that effective as a public health measure. Just washing your hands will do a fantastic job. If you want to wear gloves and you want to keep washing your hands washing the outside of your gloves, fine. It's going to help minimize the contact. You're not going to put a gloved hand in your mouth as much. But again, it's just really that idea that after touching surfaces that might be contaminated, do something to destroy the virus that might be on your hand or glove.
It's interesting, that point. I remember when I was doing some work on nutrition, that there's something called the health halo, that if someone eats something which is supposedly better for you than an alternative, that they'll tend to eat more of it.
Yep.
and cancel out any of the benefits of that health thing. And so the psychology of how humans respond to this stuff is pretty fascinating. It's not just as simple as making the change.
And that's part of why a public health commission would make so much sense, because public health experts are the ones that take into account people's behavior and how effective public health measures are, rather than some of the more hardcore scientists like myself, who it takes a lot of effort for us to do that. I try my best to, but some people look a lot more just clearly this reduces transmission, therefore we must use it for everything. But the reality being that sometimes that measure marginalize people, and it can actually exacerbate or make things worse just because it's not actually feasible for that thing to happen.
And shout out actually to, I think we have a behavioural unit in government. It was set up. It was set up to focus on justice, I believe, but has been contributing to the COVID response. So I think they have been doing some work on this sort of stuff, which is
one
really
of the best suggestions I saw when it came to trying to encourage people to wear masks is to treat them like condoms. Make them as available as possible, make them as cheap as possible, have them everywhere that you want, and help people wear them properly. I mean, obviously the one difference is there, you should be able to tell if you're wearing a mask in public, the latter not so much. But you know, like we need to actually think about how do we make this behavioral change for New Zealand easy and accessible. And if you're going masks, make them available. I wear one whenever I'm teaching in front of my class. I make all my other demonstrators who work with me wear them, so that students coming in will feel comfortable wearing their own mask because they're seeing us role model that behavior. And so I think that's one of those really key things it's a very small thing for me to wear a mask. It has a big impact on people around me feeling comfortable then to also put one on.
And you had a tip for fellow glass wearers.
Oh yeah, a little bit of tape on the nose. I think I've got a mask lying around here somewhere. Not within arm's reach, unfortunately, but you put your little mask on and then a little bit of sellotape over the bridge of the nose. Taping the mask down will stop it fogging up. If you get that nice kind of millipore tape or something a little bit clothy that's not too strong, that's good. Don't tape your eyelid. That'll really hurt when you pull that one off, as people found out the hard way. No, it works, but you know, it's those little workarounds that we're all adjusting to.
Nice. And you mentioned in your last big answer that about washing hands. And of course, we've got the standard question here. What are your thoughts on the negative health effects of humans using hand sanitizers?
Pretty mild, especially at the moment, given the opposite, which is get an infectious disease that is pretty darn lethal. So from my understanding, I think a lot of the arguments against it are looking at, it reduces your microbiome, it's all that good bacteria that you usually have in contact, you're not getting that kind of contact with, or there's the overuse and your hands just simply start getting cracked and sore and over time painful. So on the first point, the microbiome research is still very new. There's not a lot of good papers that really measure the microbiome in the gut specifically. There's a lot that kind of have proxies for it, which is mostly based on excretion, which is not actually necessarily what's going on inside you. So that's an area which I think the evidence is still emerging. And I would say keep an eye on that. I don't know, it depends how nerdy we want to get. I did see one paper that found some really interesting microbiome differences between like super pro athletes that were able to just edge out their competition because the bugs were actually consuming the lactic acid, turning it into another product, excreting that, and then that gave a performance boost to the athlete, which I was like, amazing paper. So yes, microbiomes have an effect and they're absolutely big and real, but the effect of sanitizing your hands on then the kind of things that are colonizing your body, it's not great evidence from what I've seen for that to be an effect. And the latter point, I would say, try and find some nice sanitizer that isn't too harsh on your hands. I judge companies and businesses really harshly on the sanitizer they provide. It's like my little proxy on how much they care about you. If they got that gross slimy stuff, I'm like, nah. I like a little foamy, maybe a misty one. That's where I'm at on my sanitizers. So I judge them harshly. If you want my business, provide a nice sanitizer.
There you go, folks. That's how to win the heart of Dr. Ben Pete. Win the wallet. How to win your wallet.
The wallet.
I've got to say, I haven't paid that much attention to hand sanitizers, but I'm going to now, just because you said that.
There's
a lot more attention. Yeah, absolutely. And I guess what I take away from that is use hand sanitizer for your hands, don't drink it.
Yeah, absolutely.
That's probably a good idea.
Yep.
Oh, here's a good one for you, Ben. Are you any relation to Winston Peters?
No, but I did wonder when I was younger, because it's been a fairly permanent fixture. I did toss up the idea of running a Vote for the Better Peters campaign or something like that, but I'm not sure how much we actually want to play off his last name at the moment. He's not particularly popular. But no relation to Winston Peters.
Okay, well, thank goodness.
Although maybe he might, give me some advice if I meet him in the corridor.
Yeah, I have no doubt he would. Question from Sim: do you believe there's a method to counter this? This is out. I gotta preface this by saying this is outside both of our expertise, but I'm really curious to hear if you have any thoughts on this. Do you believe there's a method to counter other particular parties' use of social media in terms of potential disinformation and scaremongering? My response before, just to give you some time to think, Ben, is that I would really love a vaccination against Jamie Lee Ross. But if that's not possible, unfortunately, the social media genie is out of the bottle, and we've seen that as the likes of YouTube has started to crack down on some of the more dangerous conspiracy theories out there. It's pushed it to new areas. They've just found new parts of the internet to focus on. So I'm actually, other than educating our people in critical thinking and the scientific method, I'm not sure I have much of an answer to that question. Do you, Ben?
Yeah, I think it's really interesting language you used there around we want a vaccine against Jamie Lee Ross, right? What I have read and some of the studies being, it's quite a big area, especially in science communication, where we're trying to go, how do we most of this research that I've looked at is around kind of climate change and how do we kind of get people to understand it? How do you kind of counter that misinformation that's going around? And one of the more effective methods is actually kind of a vaccine type approach. You tell people, as well as you can, the information that's going around. And you also go, look, these are the kind of arguments that other people are raising that we don't think are true, and here's why, before they've had a chance to really have that take off. So rather than kind of this battle of misinformation, we can kind of try and see stories before they become big and go, this is a story that's going around. A, here's the information. B, there's the story going around. C, here's why that's not quite true. And that's part of what we're doing right now, is trying to give you as much information as possible, trying to make it as personal as possible, right? Like I'm here, it's me, Ben Peters, each week coming with the information, and you can get to know me. We can kind of have that relationship. So it's not just, this is the data that we have. It's, oh, Ben interpreted that data and I've got a reasonable understanding of where Ben's expertise are, where his limits are, etc. Maybe I'll go to a different researcher for other things that are outside his scope. I'll go to Geoff for economics any day over Ben. So it's about kind of, really cultivating that audience and having that back and forth, and really being willing to say it. When I don't know, I don't know. When I do, here's the information. And trying to get that out early and often, I think, is the best approach there.
Yeah. And I guess, the thing that amazes me about some of the, some of the theories that are spinning around, how many people would it take to be in on some of these things for them to be the case? It's quite easy for me to believe that, the government is, or that government organizations are incompetent on something, but to think that everyone could be in on something quite so complicated, to deliver, and that we haven't heard about it, I think is quite extraordinary. Let alone to think that the United Nations is in on something quite this complicated. If anyone's had anything to do with the United Nations, they haven't been able to deliver anything.
Yeah. And in the New Zealand context, I just don't think Megan Woods has enough hats that she could possibly also run a conspiracy at the same time as other portfolios. Like, they just don't have the people power there to do that.
There's a gap for us then, Ben.
Absolutely.
Minister Minister of Conspiracies. Okay, this is a good question. Ben, if the virus can live on surfaces for a period of time, what systems need to be in place for PPE disposal?
Awesome. We want to be careful. And the main thing again is that hand washing, right? Because you need some kind of surface to airway contact. Most people don't lick surfaces. I think there was the report coming in that
toddlers, Ben, you've got some
yes,
of those.
I do have a less than 2-year-old who does lick a lot of surfaces. Fortunately, they seem to cope better. There's still, there are still some fatalities that happen in toddlers as well, but they seem to mercifully cope a lot better with the virus. And actually, my 4-year-old loves wearing his mask. He thinks it's super cool. My wife sewed him one, and he loves running around being like, I've got my sick mask. I can go outside now. Because I've had my kids at home for the last week because they've had a slight runny nose, and daycares are very cautious on that, which they should be, and it's good. It's just so he was very excited about the idea of being able to go outside. Anyway, disposal of PPE, yes, take it seriously. So if you're wearing a face mask, do take it off, and then try and put that in the bin. Maybe put it in a plastic bag and then pop it in the bin. It is on surfaces if it's been there, so wash your hands after touching communal areas. Again, that's kind of the most straightforward way, is just to stop a transmission route from you touching something to then being in your face, because that's the most likely, really the most likely way is just face to face, where you're breathing on each other, and then there's a possibility, but it's a low possibility, that you can then pick it up off surfaces. It's not impossible, it's just lower chance, because you have to actually touch the surface, get enough of it into your face, and that you actually then have an infection start.
I'm just getting all sorts of mental images right now. We're getting lots of comments about people's favorite hand sanitizer, so you really started something here, Ben. It's,
I'm so judgy. Yeah.
Apparently the one at New World smells like Fruit Loops. So I'm good there. Yeah.
My department one's really awesome. It's a nice little foaming one. It gives me just the right amount. I walk past all the time. Although when I'm teaching, I spray the 70% ethanol, because that's just what I was used to in my PhD. That's what we always use to sterilize, and it has a nice cooling sensation on my hands. So that was a bit nostalgic when that came back. I was like, it's like I'm doing science again in my PhD days. So that was nice. Although if you got the 70% ethanol one, don't then put that on the mask, because then you're just vapor inhaling your alcohol, which is not something I would condone. Yeah.
Except on a Friday night, maybe. So this question from Tom: with a central public health commission, will the DHBs still have their own boards? And
maybe
the simple answer is
take that one.
Yeah, I mean, what we're not talking about centralizing the whole DHBs, just the public health aspects of them there, Tom. So most DHBs, well, actually a lot of DHBs have shared public health units. So it'd really just be bringing that together into one national body. We're keeping the DHBs, but it's just the public health aspects of them that we would be bringing together. Good question here about what are the COVID stats like compared to the flu stats? I've seen stats as high as 99.95% survival rate for COVID. How does that compare to flu stats?
So there's so I think flu has a fatality of about 0.01%, and COVID, hard to really judge it. But again, we're sitting at around about 1%. If you have seen as low as 0.05, if my math is right there.
Half a percent, I think.
Yeah, or 0.5%. Or 0.5% is still 15 times greater than 0.01. Right? If my math is right. So you've already got about a 15-fold increase on flu, or if it is 0.1 for the flu, I'm a little bit hazy on that. Then you're still about 5 times greater death rate. So if you take the very low estimate of COVID and a very high estimate of the flu, the COVID is still above it by at least 5-fold, which is kind of scary. The other thing is that the flu, we have treatments for, right? We have a vaccination program, which we use, that we try and roll out and get as many people protected as possible. We have medicine that we can give in the hospital. So if you come in and you present and you're very unwell, then we have some antivirals. We have things that can stop the virus replicating, and we have ways of helping you recover from that quicker. With COVID, we don't yet, right? So COVID is A, it's already more lethal, and B, we don't have anything we can actually do when you get sick. And so that's why it's this double whammy of we should be pretty scared about it and we should be very aware of it. There's also emerging evidence that there's a long tail of COVID recovery, so it takes a long time to recover from it, and that there are other deleterious health effects that kind of linger for a very long time. Although I haven't seen any good statistical breakdowns of those yet, partly because I haven't had time in my day to dig them out, partly because we're so early in the pandemic that trying to find out how long these health effects are going for is going to take a long time before we actually get there. So it's what it looks like on the surface is that it's already a higher death rate. It's already a higher infection rate. We don't have treatments available, and there's a potential for a lot longer lingering things. I've got some stats coming up here that 80% have a moderate long-lasting negative effects, and about 30% have severe long-lasting effects. Again,
what sort of long-lasting effects are we talking?
Fatigue is a really big one. So just and a decreased lung function for a long time. So I saw some anecdotes coming around about athletes that have recovered from it being nowhere near where they should be at their game because they were just getting exhausted too quickly afterwards. So very young, fit people having quite a really long recovery. And we're not sure what that total recovery looks like yet. So I'm a little bit caged about going too far into it because I haven't done my full reading on that. And it's early in the pandemic to really know. But surface level, it's definitely a lot worse than the flu, especially because we don't have the mitigation things that we do have with the flu.
So New Zealand might have a real comparative advantage at the Olympics next year if there's been this pandemic.
And it's one takeaway.
I shouldn't be quite so.
It might even be in New Zealand if it's the only country that's COVID free. We're going to market here. If we can upscale our quarantine sufficiently, if we can make sure that's robust enough that we're not taking extra risk on. That's an option, we can
turn the South Island into a quarantine / sports haven.
Right.
Yeah.
Good. Yeah.
Hey, so just to drill in on one particular point there. So the reason why the lack of treatment is important is because that's why we're seeing these quite big differences in death outcomes between countries, because if a health system gets overloaded, then it's quite easy to have a higher death rate as a result. So yes, the death rate from COVID can, it's always going to be higher than the flu, but in some countries it might look quite low. But if you get to the stage where your health system gets overloaded, you can see it rise quite markedly.
Yeah, and it's not just the COVID deaths that are the problem there, right? When you have someone in a hospital with COVID, there is a huge extra burden to treat that person, just keeping them watered and fed, because you have to go through the full quarantine every time you go in and out, right? So it's a huge burden on the health system to keep people with COVID in the hospital, again, because you really don't want that moving through your hospital, so you have to be abundantly cautious. That takes away the services from other people that want regular kind of health checkups. And so you can end up having other fatalities as a result of a clogged hospital system, because there's not enough of space really for people who would otherwise be getting treatment for things that are kind of treatable, that are then much less able to get in there to get that treatment. So it's not just about the COVID at that point. It becomes about the health system as a whole collapsing. You have all your nurses and your doctors working way too hard. They're more likely to make mistakes. They are going to get fatigued, and you're going to have more fatalities as a result of an overworked health system coming into play there. So there's a lot of issues going on and a lot of reasons why you really, really want to keep your infection rate low. All of the early stuff, there is not a single country that is not trying to do something to mitigate the effect of a completely uncontrolled infection, right? Even the most liberal and also not liberal, even the most unrestrained or libertarian, just go for it, do whatever you want, are still trying to do something to make sure their hospital systems don't get overwhelmed. That's what our initial data was going. Let's try and get these little waves going so we can always keep, not too many people in the hospital. New Zealand then flipped the switch and went full elimination. Other countries are still in that. Let's try and just keep things moving over slow enough so we can delay it for long enough until effective treatments are ready, until potential vaccines might be able to help, that kind of thing.
Yeah, I mean, even the ACT Party seems to have agreed that elimination is the best
The
strategy.
idiots not to.
Yeah.
We
Question from, sorry.
Anyway. No, you carry on.
Question from Jonathan: can I wash and dry a face mask?
Yeah. Warm soapy water, do it for a while. I think there's some nice instructions out. Make sure it is fully dried. If you want, so warm soapy water should do the trick. I think mild vinegar is enough to break it down. There were some papers done early on which looked at, what does it take to actually pop the virus? Surprisingly, not much. It's not actually that robust. It can live on surfaces for a while if they're undisturbed and if nothing gets on it. But it's relatively easy to kill the virus with some good soap and especially a really nice hot soapy sink, and then give it a good rinse and let it dry fully. I'd say, do some Googling on the best ways to do that as well. Potentially, if you've got fabric that can handle the oven, chuck it on in the oven for 65 for a while. Do make sure that it's not flammable. Regular washing of clothes is a great example, right? The idea is we don't need to specially treat our clothes. If you've been breathed on by someone with COVID, you can put them through a hot wash, put them through the dryer, and they'll be fine. The virus isn't surviving that.
Nice. Another great question, which I imagine people feel like they can't they can't ask normally because it might seem like a silly question. If COVID can be spread so easily, why do they need to swab so far up our noses instead of just taking a saliva sample?
That's a great question. So it's a lot to do with, they could just take a saliva sample, and for some patients that would be fine. COVID is not a very mucousy infection. So distinction, COVID is the sickness, SARS-CoV-2 is the virus that causes it. So when you have COVID, it's often not that mucousy. So runny noses was quite a late symptom that they added to the list, I think, because it wasn't that common. So you don't have a lot of just goop that's holding a lot of virus often in your mouth, but as you're breathing it out, you are shedding virus in these tiny little particulates that are going out. In a single breath, it's quite a small amount, right? And it's going to be very difficult to actually amplify it up from a single breath. Not only that, it's really hard to actually from a breath to turn that into a test, or from a saliva swab you can, but again, we really want to be as certain as we can that negatives are negatives and positives are positives. By going all the way back and kind of tickling the back of the throat, there's a little kind of mucosal point which will trap a lot of the viruses that's coming through, or a lot of it will hit there. And so that's a really good place that we can swab in order to get the best chance of getting not only enough material to get a positive or negative on the PCR test, but we're hearing more and more about the genomic work they're doing, and that requires a significant amount of material to be able to get a really nice genome out of that. And so the better starting material, the more likely you can get a genome, and that will also help us in our track and trace efforts.
Nice. And how accurate are these tests?
Enormously. So in terms of specificity, that is, how likely are they to detect COVID instead of other things? They're kind of near 100%. You never say actually 100%, but the chance that there's a false positive is very low. They're enormously specific. If you add in genome testing, then it's nearly impossible to detect a SARS-CoV-2 strain and get a genome that matches SARS-CoV-2 if there wasn't SARS-CoV-2 in the person to start. So that put together, we can be very confident when positives come up that they are truly positive. On the negative side, it is possible to get a false negative test. And again, if in the massive upscaling of rolling out the tests, if people haven't been trained well enough on how to get that swab all the way to the back and not just stop halfway, that's can contribute to a false negative. If there's an error in the processing along the way, this is an RNA virus. That won't mean a lot to most people, but RNA is a lot more unstable than DNA. So there's an extra processing step in there to turn RNA into DNA, so then we can do the test. In that step, if something went wrong, again, there's another possibility of a negative. So we want the negatives to be as few as possible, but there's always a chance that we are getting some negatives while the person is infected. And really, we're hoping that as the country gets more used to it, as our workers get more used to administering it, they're getting better, and that negative rate will come down and be as low as possible.
Okay, so small chance of a false positive, which is saying that someone's got COVID
Nearly zero.
when they don't have COVID. Yeah,
Yeah.
and a false negative is if you do have COVID and the test says you don't have COVID.
Yeah.
So there's a bigger chance of that. Right.
Yeah, not by much, but it would be a slightly bigger chance that you get a false negative there.
Okay.
Yeah, which is, I mean, we had quite a number of probable cases listed by the Ministry of Health, right? Cases which had symptoms, who had contact with people, but didn't have a positive PCR test. And so to be cautious, we just are treating those as if they are positive.
Nice.
And because there is that chance that the test has not quite worked in somewhere along the processing. And often if we have a second or a third test, then we're able to go back and see whether that's true or not.
Right. Question of clarification, presuming we're talking about washing cloth masks, not the disposable surgical masks.
Yeah, that was somewhat of an assumption.
Yep.
There are protocols out there for reusing the disposable surgeon ones. I just probably wouldn't. Yeah, they're like $1 a pop.
Easier not to. Yeah.
Easier not to. And if you want to go down the reusable route, then yeah, grab a reusable one and do a lot of washing.
Another question here, disposable face mask versus reusable fabric face masks. Any recommendations?
Go for comfort, right? End of the day, the actual quality of how well it's stopping your breath getting around, a good cloth one can be kind of on par to the surgical ones because, again, they're not super tight fitting. I've got a beard, so there's a lot of air escaping out all over the place. But it's stopping that velocity of spread of air coming out your mouth. So at the end of the day, the king is absolutely comfort. So comfort's absolutely king because you want to be wearing your mask as often as possible. That's really where the health benefits are, rather than this one or that one. If you've got a really uncomfortable one, you're just not going to want to wear it as much. So find one that's the most comfortable for you. Obviously, don't try them on in the store. That's one thing we're not recommending.
It's like trying the undies on.
Right, just get in there. So yeah, it is just try and find a pattern that's comfortable. Ask friends what's worked well for them and their face shapes. Like I've got quite a long face, so the surgical masks are a bit of a stretch on me. I've got some cloth ones coming, I think, that I'll get into soon.
I wanted to ask you about that, Ben. Are you a bit sad about something?
No
long face. No. Sorry, it's just
it's so late.
Yeah, I know.
No, it's not late. It's only 6:30. It's just been a real long week.
Yeah, absolutely. Should we? A question from Laura. This is a cracker. Should we be doing a long-term study on this, on a selection of people who've contracted it, in case there are long-term health implications that could show up later in life and impact public health care later?
Absolutely. I mean, it's going to be really rare for me to say we shouldn't do a study. Just my natural background is like, of course we want to know
research.
That. Why would we not want to know that? Like, yeah, let's get in there. For New Zealand, it might be a bit difficult because we had quite a limited number of cases in the first place. But I would hesitate to say guaranteed, but very, very likely that there are studies going on internationally long-term, or at least keeping in contact with patients over a long term. New Zealand, we do have public health numbers and things like, so you have your own health number. So you will have contact with your GPs. And so if there are things as time goes on, then that will be able to be studied anyway without specific recruitment, although obviously you'll need ethical considerations for those kind of things.
Right. We've got time for a couple more questions. This is an out of the box one for you from Joe. Speaking of an advantage at the Olympics, what do you think about the idea of bringing in tourism from international sporting sources, such as having them go through quarantine, then having the likes of, say, the NFL competing here in New Zealand, fill our stadiums with a real live and COVID-free audience, bring in the millions and millions of dollars from the teams and their management, etc., encourage people to get out and get international eyes on New Zealand?
I love these kind of ideas, like it's not about, hey, let's open up the border. It's like, hey, let's market ourselves as a really high value destination that has no COVID, or we do have it in Auckland, right? If we manage to squash that, then we have a huge payoff that's ready for us. Especially if we can upgrade our quarantine facilities to handle that. And whatever that looks like, again, you need to talk to a wide range of people to actually get that idea going and moving. But yeah, I love that idea. I'd love to have Formula One here in New Zealand, but that's just because I like watching it. Like there are a lot of things that we could absolutely have.
Really? Formula One?
I know. There's something about
They just go round and round.
Yeah, but sometimes they turn left, other times they turn right. And a lot of the time things break, like,
That's true.
or like competitive computer gaming, things like that. Like I love watching that. That's been able to keep going, which is awesome.
That's been a big bolt, a big jump in the market, right?
Yeah. Oh yeah, and I think like New Zealand should be trying to get behind that market. I think we need to really have a big message going out to parents that playing computer games is a valid career path. I think that's hot take of the night. Hey, studies have shown that if you play computer games, you'll be a better surgeon. You heard it here first. Or true. Actually, that's true. In the scientists, yeah. But I think there's markets there that New Zealand can absolutely look to pivot our brand to go, look, New Zealand, we are the international leaders on a COVID response. Let's keep going with this strategy. Let's absolutely nail it. Anytime it pops up the tiniest bit, know that we're going to squash it. And then to actually have an economic payoff for that, we have to capitalize on that structure, on that the investment we've effectively put in by trying to attract these big international gigs.
So a couple of questions from people who have come late on, and this is quite a nice way to wrap things up because these clearly have been some of the key points of the night. One, do you want to summarize again the stats on the severity of COVID?
Yep, it's pretty bad. So we've got about 700,000 deaths worldwide, 24 million cases worldwide. So it's clearly a huge global pandemic that we need to be concerned about. Death rates vary anywhere between 5% of the absolute upper limits down to about 0.5%, depending on where you're looking and what you're seeing. So it's important that we, as quickly as possible, find treatments for it. Vaccines, again, are hopefully going to help us an awful lot, but I wouldn't be putting huge amounts of, I wouldn't preempt the data coming out on how effective that is, though. Is that roughly what we're looking at?
Yeah.
And there's potential for some long-term harm there that we haven't really quantified yet.
That's right. And one last question on the thoughts on New Zealand's current buy-in to international vaccine efforts. Are we doing enough?
Great question. I think our contribution of research, I think, is going well. It's hard to know exactly what's going on because I'm not involved in those agencies and I don't have a direct line, so I'm not sure exactly what the collaborations are. We are part of a lot of the international trials that were going on early, which obviously we haven't been able to contribute a lot because we don't have a lot of active cases. So big win for New Zealand, but difficult then to actually kind of mixed win on how much we're contributing because we don't have cases. In terms of vaccine, I think we could be doing more to getting New Zealand ready to produce if possible. And again, you'd have to talk to the institutes that are actually doing the vaccine production currently for agriculture sector and around building up that capacity. And then when licenses become available to actually start production in New Zealand, you do need a good lead-in time for a lot of these vaccine productions. You can't just ramp it up overnight unless it's some of the newer and less well-established vaccine treatment options. But we can go into that another time.
Absolutely. And thank you so much. Speaking of another time, I'm sure there will be another time, Dr. Ben Peters, because, we haven't heard what's happening with the lockdown yet, but I think we're probably not out of the woods just yet. So I think
absolutely not.
I think it's very probable that we'll have another session next week for people to keep asking their questions. And thank you for your time and expertise. It's fantastic to have you on the team, and always good to catch up.
Awesome. Thanks for having me, Geoff. I love to have an opportunity to actually put all my reading into practice.
Enjoy your Friday night down there in Dunedin.
I will. Awesome. See you, team.
Thanks, Ben.